Good evening and welcome. I'm Kevin Edwards of Allied Physicians Group, and thank you again for joining our COVID-19 patient-focused webinar series. Tonight's topic is on what to expect when expecting during the COVID-19 pandemic. Our hope is to provide you with valuable answers to many of the questions you are facing during this time. But before we get started, a few housekeeping details. If you have additional questions, please use the Q&A feature located at the bottom of the screen, and we'll address as many as we can after our presentation. Following this webinar, we will send out a link to this presentation as well as share some other useful information. We thank you again for joining us. And with that, I'd like to introduce Dr. Carrie Firestein from Allied Physicians Group, who will be leading our discussion this evening.
Thank you, Kevin. Yeah. Yes, thank you, Kevin. Thank you, Allied and Adjuvant, for setting this up. I'm Dr. Carrie Firestein, Chief Executive Officer of Allied Physicians Group, practicing pediatrician for over 30 years, mother of 3, and now grandmother of 1. My first grandchild was born 5 weeks ago, so I know many of your concerns firsthand because my daughter and our family have them too. Having a baby is so exciting and really scary. We want to do everything right so our baby is born healthy, even as we know that we are not in total control. The COVID pandemic has added so many more unknowns to the equation. The world around us can go on pause, but the baby inside of you continues to grow and develop as if nothing has changed. And when he or she is ready to come out, they won't ask permission. There are many things about COVID-19 that doctors don't know yet. Tonight, we will share what we do know because you need information you can trust. Tonight's presentation is going to be broken down into 3 parts. Pregnancy and delivery will be discussed by our 3 obstetrician gynecologists from Premier Women's Health, Dr. Hank Prince, Dr. Janine Morris-Rush, and Dr. Melissa Oppenheim. Newborn and breastfeeding will be discussed by Dr. Sal Caravella, Allied Physicians Group Chief Quality Officer. Dr. Caravella is a general pediatrician with extensive neonatology training. Perinatal mood and anxiety disorders will be presented by licensed mental health counselor, Carrie Groschow. Most of your questions will be answered during the presentation. At the end, we hope to have time for additional questions and answers if needed. So let's get started with COVID and pregnancy. Dr. Prince, it's your turn.
Carrie, thank you very much. Many people want to know what effect COVID-19 has on the pregnant women. Most important, pregnant women do not appear to be any more susceptible to acquire the coronavirus than anybody else. You're young, you're healthy, and the majority of pregnant women will experience only mild to moderate cold or flu-like symptoms. Now, when this whole pandemic started, we were extra concerned because, in general, women who are pregnant have a tamped down or decreased immune system. But to date, we have not seen an excess number of very ill pregnant patients, which has been very encouraging. Next slide. Next slide. We do know, however, that just as any other group of patients, the prior slide, please. We do know that just like any other group of patients, pregnant women who have pre-existing health conditions are more prone to have a more serious infection. Certainly, pre-existing heart disease, diabetes can certainly be risk factors for a more severe complications from the COVID virus. Next, please. The biggest question that everyone has is, what effect will this virus have on my baby? This is a brand new virus, and the data that we have is just really coming in. But it's very important to understand that there's no current evidence that there's an increased risk of miscarriage or that the virus can pass to the fetus. In other words, if you were to develop the virus while you're pregnant, there does not appear to be any evidence that the virus can go through the placenta and infect the baby in utero. Now, we've all heard about reports that babies have been born and they were positive for the COVID virus. we truly believe that these reports have been incorrect, and that in fact, when symptomatic women deliver a baby and then hold the baby, they can certainly give that baby the virus just after delivery. At North Shore Hospital and at LIJ and all the Northwell hospitals, and you're talking about a very large number of patients who have been delivered, none of the babies who have been delivered of COVID-positive mothers have tested positive immediately after birth. So we have every reason to believe that this virus does not pass through the placenta, and that when you hear about a baby getting the virus, it's because the mother has given the baby the virus after delivery. Now, the other concern regarding the virus is, what about the virus itself? What happens to the baby when the mother has the virus? And the only real concern is the very high fever. There is some suggestion that high fevers above 101 can cause damage to an infant in the first trimester. So in the first trimester, every effort should be made to keep the temperature below 100.5. And you can do that with taking Tylenol, cool showers, a cool tub bath, but certainly also, please feel free, and it's important to contact your healthcare provider if you feel that you may have the virus during any point in your pregnancy. Next slide, please.
Hi, it's Dr. Morris Rush. It's a pleasure for me to be here today. I'm always happy to reach out to patients. Again, I'm going to stress this is an interesting time for us as providers, and we are trying to do the best we can and reassure our patients the best we can that we're all going to be okay and we will get through this. And our numbers are decreasing in New York City and New York, and these are all good, positive things. So we've made many changes to our office and the hospital and our procedures during the coronavirus pandemic to keep our patients, staff, providers all safe. All the necessary diagnostic tests are still being done at the same time as always. This includes 12-week ultrascreen, the modified sequential, which is done between 16 and 18 weeks, a sonogram at 20 weeks, and diabetes screening tests. What's interesting is we typically only saw patients every 4 weeks in the first 2 trimesters. So spacing out patients in our office to make sure people continue to social distance is of utmost importance, but we're still connecting with our patients. This interval has been increased to about 5 to 6 weeks with telemedicine visits between visits if we feel like patients need to be seen a little bit more frequently due to any medical problems. In the 3rd trimester, we always had seen patients every 2 weeks until 36 weeks. We've adjusted this, we've spaced this to every 3 weeks, and we again are adding telemedicine appointments where patients take their own blood pressures and we're able to ask all important questions and make sure patients feel their baby's moving. Once the patient is 36 to 37 weeks, we still do appointments at that time, but we're seeing patients every 2 weeks, again with blood pressure checks and telemedicine visits, so patients have appointments every single week. What changes will you see when you come to our office? The most important thing is we're trying to continue social distancing, which is the most important thing to prevent the spread of a virus. So there are no longer waiting areas for patients to congregate. When you're in our office and you have an appointment, you will be instructed the day prior to call when you have parked your car, and our office will call you while you're in your car when your room is actually ready for you. You will be directly escorted into the room when the doctor is ready for your visit. And of course, all of our rooms are thoroughly cleaned and decontaminated after every visit. And frankly, this has not changed prior to COVID. All of our patients and staff wear masks throughout the visits. We've gotten a lot of questions about, should I work during this COVID-19 pandemic? So when at all possible, of course, patients should work from home and remotely, as there is an active stay-at-home order through New York. But pregnant healthcare workers remain a vital and active part of our team, whether it's doctors, nurses, staff at the hospital. There are many pregnant healthcare workers that are encouraged to continue working, and we're recommending that they continue working as they're so important to our healthcare system. If you are an essential worker, you may remain working using all the proper precautions, such as wearing masks, the proper personal protective equipment, including N95s, while in direct contact with patients who are of concern or COVID positive. So if you're a healthcare worker, a first responder, remember, practice social distancing even at work. Frequently wash your hand. This is true for all patients, and wear masks as we've already discussed. What's interesting to note, and actually quite reassuring, is that the hospital has been doing antibody tests on patients, providers, all healthcare workers, and we realize that our positive antibody tests in the hospital are actually probably lower than the community. So whatever we are doing to protect ourselves is working. So people who are pregnant and are in the healthcare system should remain working.
What is currently going on? Hi, sorry, this is Melissa Oppenheim. I'm so glad to be here too. So I'm going to just discuss what's going on right now at the hospital, the North Wellman-Hasset LIJ system. Currently, all patients who come onto the labor floor in labor or not will be tested, have nasal swab testing for COVID-19. If someone is scheduled for a C-section, they will have an appointment to have testing 3 days prior, and the results will be reported at the time of admission. Pregnant women will be allowed to have one visitor or support person in the hospital. The visitor is the same visitor throughout the visit, so they may not be swapped. And the visitors are not being tested right now for COVID-19 because there's limiting in testing. The partner will be able to stay with you throughout the labor and delivery and once you're admitted to the labor floor. Currently, if there is a private room, then your partner can stay throughout the visit. If that is not the case, then the partner will be allowed to stay until you are transferred to the postpartum unit. Once someone's birth partner leaves, they will not be able to return to the hospital until it's time for discharge. Any patient, all patients and partners will be wearing masks throughout the hospital stay. And if someone is COVID positive, they will be given an N95 mask for the stay. Next slide, please. Do babies get tested for COVID? So currently, if a patient is positive for COVID or the mother is under suspicion or has symptoms, the baby will be swabbed after 24 hours. Next slide.
Antibody test. This is a popular conversation. Everybody wants one, but no one really needs it. Currently, the public has been offered tests that are not FDA approved. Some of them have rates where there are lots of false positives and false negatives, which is not okay. We need this rate to be well over 90%. So to make a long story short, they're not ready for prime time. We need to remember this. Do not run out and go get tested. Because if you are positive, it should not change anything that you do. The CDC is currently still recommending everybody wearing masking precautions, wash your hands, don't touch your face, do not change anything that we do. So the word is still out and when we should start getting antibody testing, if even the masses should be.
Just one other thing regarding our GYN patients and also pregnant patients and risks of blood clots. There have been reports of men and women under the age of 50 with COVID who have severe disease and major vessel clots. We have not seen an increase in blood clots in pregnant women who have COVID, and we also have not seen an increase in stroke or DVTs in women who are on the birth control pill. So we are not changing any recommendations as far as taking birth control pills during this time.
Thank you, guys. Next, we're going to have Dr. Caravella talk about newborns and COVID.
Thank you, Dr. Firestein, for this opportunity to share important information regarding what to expect when expecting during COVID-19. First, no one anticipated the current situation. For first-time mothers, the pandemic has brought new concerns. Prior to COVID-19, there was separation, preparation, and excitement. Unfortunately, COVID-19 does not play by the old rules. There are things you need to do, learn, and prepare for, all while keeping yourself, your family, and your baby healthy and safe. Your care team, obstetrician, pediatrician, nurses, and staff will all help you. But first, the basics. So, choosing a pediatrician. It's an important decision that you will want to make before you give birth. Your pediatrician will serve as a partner and advisor. The pediatrician you choose will come to know your family, and you need to be comfortable with your choice. During your baby's first year, you will be visiting the doctor at least 6 times for well baby checkups, vaccinations, developmental screenings, and not to mention an unplanned visit for a fever or a first cold. The care your newborn receives will shape the quality of their life and health throughout childhood. The lessons learned and preventive measures taken will last well into adult life. Parents need to feel they can trust their pediatrician. COVID-19 has made choosing a pediatrician difficult. However, telehealth can ease the way. Taking the following 5 steps and tips into account will help you pick that pediatrician. First, do your research. Start your list by asking family and friends, consider location, office hours, after hours care. Is telehealth available? Is your health insurance accepted? Then you can check credentials and experience. A pediatrician specializes in the care of infants, children, and adolescents, and has completed training in pediatrics. Board certified by the American Board of Pediatrics is acknowledgement of this training. Make sure your doctor is up to date with current practices. Medicine and healthcare change rapidly. Staying current ensures the best care for your family. Ask your questions, very important. Your prenatal telehealth visit will enable you to meet the doctor and staff, and you can ask questions about their philosophy of care. Now, during the first few visits after your baby is born, pay attention to how the doctor interacts with your child. This alone will determine if your choice was a good fit. Next slide, please. When you arrive at the hospital, COVID-19 testing is likely. The idea here is safety for all. After you deliver, your newborn will be assessed, APGAR scores given, and eye prophylaxis given. Any infant in difficulty will be treated by the neonatal care team on standby. Delivery services have established COVID-19 protocols. Expectant mothers should discuss the various protocols that may be used before they deliver. There is some variation between delivery services, but the general idea is for the mother and child to bond, be together, stay safe, and stay healthy. Every effort will be made to ensure this. For a mother who is not feeling well and pending COVID-19 results, specific policies will take effect. After delivery to 6 hours after birth has been termed the transition period. During transition, infants are closely monitored to ensure the infant adjusts well to life outside the womb. It is at this time that infants with medical problems will be identified. In the transition area, the newborn is reassessed. Height, weight, head circumference, blood sugar, oxygen saturation will all be performed. After the transition period, babies at risk for COVID-19 will be placed in an isolate in a designated area. Additional routine care includes a dose of vitamin K to protect against bleeding and the first hepatitis B vaccination. It is best to give the hepatitis B vaccination within the first hour from delivery. Contrary to the many myths, hepatitis B vaccine has been around for over 30 years and was developed especially for newborns. The pandemic has changed the length of stay for well babies and their mothers as well. A typical vaginal delivery will be discharged in 24 hours and a cesarean after 48 hours. Prior to discharge, the infant will be weighed again, have their hearing tested, have a heart screen, have a jaundice test, and a mandated PKU test. Due to early discharge, follow-up at the pediatric office is essential and should be within 1 to 3 days of discharge. Next slide. But what happens when the mother has symptoms of COVID-19? It does get complicated, but there are protocols for the various possibilities. For example, if a mother has symptoms and has a positive test, the baby is considered under investigation, is protected, then tested at 24 hours. If testing is not available, this baby is held in an investigation for 14 days. If the baby tests negative, this isolation continues and the baby is retested at 48 hours. If the second test is negative, the infant may be discharged, but will require close follow-up for 14 days from the date of the mother's test. If the mother has symptoms, a positive test, and the baby has a positive test at 24 hours, isolation of both mother and baby is needed. A positive tested baby will be retested at 72 hours if still in the hospital. If the infant is discharged, then close monitoring and isolation will be needed for 14 days from the positive test. If the infant is still in hospital due to illness, isolation is maintained until there are 2 negative tests. Next slide. But what if the mother has no symptoms, but tests positive? Similar protocols are there. The baby is considered under investigation and tested at 24 hours, just like before. If testing is not available, the baby is under investigation and observation for 14 days. If testing is negative, that test is repeated in 48 hours. If the baby is negative again, the child may be discharged, but will require close follow-up for 14 days. And last, what if a mother and baby are both positive? Both are placed in isolation. Baby is retested after 72 hours if still in hospital. The child has been discharged, close monitoring and isolation for 14 days from positive test. Baby and mother will require 2 negative tests before removing isolation protocols. Next slide, please. As pediatricians, we encourage breastfeeding of infants. There are numerous studies documenting the positive benefits of a mother's milk. To date, there is no evidence of the presence of COVID-19 virus in breast milk of an infected mother. If you are nursing at home and feel well, continue nursing, practice social distancing, clean surfaces appropriately, and be meticulous about washing your hands and your breast care. If you want to breastfeed but are ill, you still can, but you need to take some precautions. The CDC recommends that mothers and their healthcare providers discuss the benefits and risks of breastfeeding. Given the uncertainty around transmission of COVID, mothers should participate in these discussions. Efforts should be made and focused on limiting the risk of transmission through good hygiene. There are 3 basic options. Mothers can practice skin-to-skin and breastfeed while in hospital with some modifications. Mothers should wear a surgical mask when near the infant and practice good hand hygiene and clean their breast area with soap and water before each feeding. If rooming in, and the baby and mother should attempt to maintain 6-foot distancing whenever possible. The primary concern is that the virus will be transmitted from mother to infant through respiratory droplets during breastfeeding. Mothers who choose to pump must ensure good hand hygiene and meticulous cleaning of equipment. The infant can then be fed the express breast milk. At home, frequently touched household surfaces should also be disinfected regularly. If a mother is too sick to breastfeed due to COVID-19 or other complications, she should be encouraged and supported to express her milk so that the baby can be fed via bottle from another caregiver. Next slide. The first pediatric office visit has never been more important. Due to shorter well baby stays in the hospital, the first pediatric office visit is essential and should not be postponed or avoided. Although most infants have little to no issues, there can be some serious issues that need to be addressed. Please remember to bring all the paperwork that you were given at the hospital when you were discharged. That information will be added to your baby's chart. Keep in mind, all babies lose weight before they gain weight. Exclusively fed breastfed babies will take up to 2 weeks to regain their birth weight. Other measurements like length may be different. Measuring a newborn is not a precise science. In addition to taking measurements and doing a complete physical exam, the doctor will check the umbilical stump for healing. If the child had a circumcision, we'll check that, make sure that's healing. They'll do a newborn jaundice test. Jaundice is a common problem, usually temporary. With jaundice, your baby's skin appears yellow. For darker skinned infants, this can be harder to assess. A blood test to check the bilirubin level may be needed. If this test is required, it should be done. The doctor will also review with you the various skin findings, birthmarks, rashes. Frequently, these may not all be visible at the first office visit, but they may appear later. If you are concerned about a new rash or a birthmark that you feel cannot wait for your next scheduled appointment, a telehealth visit may be warranted. The first baby visit will be one of many. If your newborn did not have the first hepatitis B vaccination, this is the time for this vaccine to be given. Your pediatrician will discuss with you the vaccine and WellCare health schedules established by the American Academy of Pediatrics. Pediatricians encourage mothers to make their WellCare appointments in advance and to not delay any required vaccinations. Vaccinations and the vaccination schedule for our children is probably one of the most important public health initiatives of the 20th century and will continue to be so in the 21st century. Within the past 2 years, we have seen a resurgence of measles in the US and Europe, polio in the Middle East and Africa, and countless other preventable illnesses. Like most parents, you're concerned with what is given to your child. Myths regarding vaccines that are given to the young still flourish in this country. The United States vaccine program has been thoroughly vetted and is safe. The main reason we vaccinate early is because these preventable illnesses are the most severe to our most vulnerable, our young children. In 2008, after the H1N1 flu epidemic, we began vaccinating infants as young as 6 months for the flu. This alone decreased the rate of death from seasonal flu for children greater than 50%. Now more than ever, we have seen the devastation and death from a virus in which no one is immune. We hope for treatments, but the best treatment is to never get sick at all. We can mitigate, but to truly stop this pandemic, we must vaccinate. Next slide, please. Thank you. Unfortunately, there is not many published reports regarding actual infection with COVID-19 in infants under the 3 months old. Studies from Wuhan, China demonstrated that only 10% of newborns tested positive from their positive mothers. That's not an indication that they received it before they were born, but that was the information that was presented. These infants presented with fever and pneumonia, but all of these infants improved. In France, recently published in The Lancet, only 35% of infants with suspicious symptoms that were under the age of 3 months tested positive for COVID-19, and all of these children recovered very well. These infants also had fever, but no pneumonias were documented or identified via X-ray. There is still much to learn about this illness and the pediatric population. Even today, there was a report of 15 children in New York, many of whom are recovering from COVID, with other symptoms not generally associated with this virus. Pediatricians are constantly updating themselves to ensure that your children remain safe and healthy. Thank you. I hope this webinar clarified some of the issues that you might have when expecting during the COVID-19 pandemic.
Thank you, Dr. Caravella. So many of you submitted questions about newborns and visitors. Who can come and when? Can they hold the baby? This question is close to my heart, as is the beautiful baby boy you see on the screen, my first grandson. We are learning more about COVID every day, but there's still lots we don't know. So let's start with what we do know about babies and illness. Having nothing to do with coronavirus, it is important to keep infants under 2 months of age from getting a fever more than 100.4 rectally. Not because the fever itself is dangerous, but because it triggers a hospitalization to look for very serious infections that can come from the womb. So just as before the pandemic, it seems that a reasonable plan is that anyone who is sick should stay away and anyone who touches the baby should wash their hands. But during a pandemic, who is sick or likely to become sick is complicated. In the hospital, you aren't allowed any visitors, but what about when you come home? The easy answer is that social distancing is best. If you want to make the risk as low as possible, minimize visitors to those who are really important, like grandparents, and those who are feeling well. Let them view the baby from 6 feet away, preferably outdoors in the shade. But we all know that easy answers don't always work with newborns. Having a newborn is a life-changing, stressful event, and sometimes we need help. This is where you have to figure out the risk-benefit ratio. If grandparents have been strictly quarantining themselves for over 2 weeks, the risk is really very low. Our next presentation is going to discuss perinatal mood and anxiety disorders. If a parent needs help, then they need help. If grandparents or other potential helpers have been socially distancing themselves and they feel well and they wear a mask, the benefit of helping hands likely outweighs any risk. Someone submitted a question about a newborn photo shoot. To me, that's a risk with minimal benefit, but everybody has to make their own decisions. What happens after 8 weeks when we're beyond the time when a fever automatically sends the baby to the hospital? It is still a risk-benefit equation, just with less risk. We cannot keep our babies in the bubble of quarantine forever. At some point, we need to relax the restrictions while still being careful about hand washing, wearing masks in public, social distancing as best we can, and staying away from everyone else if we are ill. We know that children, even babies, who get the virus tend to recover really well. We also know that a loving grandparent and extended family add much value to a child's life. We'll get more of this question later on. I'm now going to pass the microphone to Carrie Grosho, who's going to talk about postpartum depression and other perinatal mood disorders.
Thanks so much, Dr. Firestein. I'm so happy to be here, and I'm hoping that I can help any of you that need it now or may in the future. So I'm going to talk to you about perinatal mood and anxiety disorders. Basically, that's a general term we use to describe a wide range of emotional disorders that a woman can experience during pregnancy and after the birth of her child. So some examples that you may or may not have heard of include postpartum depression, post-traumatic stress disorder, anxiety and panic disorders, obsessive compulsive disorder, and then the more severe cases are postpartum mania and postpartum psychosis. So approximately 60 to 80% of women experience the mildest change in mood, which is not an official diagnosis, but a lot of us have heard it referred to as the baby blues. In fact, I would say that that percentage is actually much higher. Just a lot of what we're going through isn't always reported. Women don't always want to talk about how they're feeling, but really most of us experience some form of the baby blues. This refers to a period of temporary moodiness. It will usually begin as early as 1 to 3 days after the delivery, and symptoms can include sadness, irritability, frustration, extreme fatigue, but these symptoms, they'll kind of come and go and usually disappear within a couple of days. The maximum you'll feel it and still kind of consider yourself within the baby blues is about 2 weeks. The most common PMAD that many of us have heard of is postpartum depression. So this is similar to the baby blues, but the biggest difference is that it's much more persistent, meaning that it's lasting pretty consistently throughout the day, and it usually occurs for much longer than 2 weeks. So these symptoms usually develop a few weeks after delivery, but can occur at any time within the first year after childbirth. And these symptoms are a little bit different. There's more frequent crying, there are sleep disturbances, these intense feelings of anger and or irritability. Women can experience anxiety or panic attacks. And again, in the most severe situations, there are also suicidal thoughts. So what does that really look like? The new mom may feel overwhelmed, inadequate, and unable to cope with her new role as a mom. Although she's absolutely exhausted, she may be unable to sleep. A new mom can worry obsessively about the baby's health while also feeling guilty about not bonding emotionally with her child right away. Many women, as I mentioned before, we're ashamed of these feelings, and often we don't talk about them or we don't seek help. So I thought when I saw this little cartoon, it kind of really can demonstrate what we're going through. You know, our partner will say, oh, do you need anything? And our immediate reaction is, nope, all is good. But really in our heads, we need a home cooked hot meal, a shower, a break, some time to ourselves, you know, and the list can go on, but we're not really willing to share that. So as mentioned, you're not alone. So many of us experience a lot of these symptoms. In fact, in New York State, over 150,000 moms will experience a perinatal mood disorder, such as postpartum depression or anxiety, every year. And again, that number is way higher if we're even just talking about the baby blues and just some of these feelings of overwhelm. The causes of postpartum depression may include the dramatic change in hormone levels that are occurring during and after pregnancy. We're really in flux. That can also be affected by whether we're breastfeeding or not, and those levels go up and down until they really level out. Of course, there's sleep deprivation with a newborn, as I'm sure many of you have heard of or experienced. Sleep is very difficult to come by, and that can really affect our mental health. There are psychological stresses of new motherhood, of becoming a new mom, entering into this role and learning how to deal with it. And we are at a higher risk if we've had previous postpartum disorders or clinical depression at any time in our lives. And finally, a family history of depression also increases our risk. So how is this being affected by COVID-19? To be honest, women are experiencing the same symptoms during this pandemic as we were before. I think the biggest difference we're seeing is that they're even more magnified now. A lot of that is due to the isolation that we're feeling, even more so during the pandemic. Normally, after you give birth, things like socialization and routine are very highly encouraged. But right now, during the COVID-19 pandemic, those may seem almost impossible. But not to worry, there is hope and things that we can do about it. So one of the most important things to do is early detection. So your pediatrician and or your OBGYN should administer a test during your early visits called the Edinburgh Postnatal Depression Scale. So it's a list of questions. I have a link there where you can actually see the test. And depending on your score, it's how we determine if you are at risk for any of the perinatal mood and anxiety disorders, most specifically postpartum depression. So whether or not your score on that test indicates anything or you're just really not feeling like yourself, there are a lot of coping strategies that you can implement to try to help. Absolutely try to take some time for yourself every day. As much as your whole world has maybe become about your newborn baby, you can really only be as good of a mom as you are to yourself. So it's really important to take a little time for you. Of course, to eat well, exercise, you know, while that may feel difficult, especially now as the weather is starting to get warmer, taking walks outside, getting some fresh air, kind of getting your blood pumping can really help. With that being said, of course, you also want to rest as much as possible, which becomes very difficult to do with a newborn, but to try to get that time in, you know, becomes pretty imperative. You know, it's a good idea to find ways to socialize during this pandemic, FaceTime, Zoom, other social media groups. You want to be careful not to join too many that kind of bombard you with too much information, but just a select few to help you feel supported in what you're going through. Along those lines, to find support, whether it's from family members, from a close social circle, your friends, or a therapist, someone to talk to really be able to get out the things that you're feeling. Another option is a lot of baby classes are online now through Zoom or Google Meet. You know, as your baby grows a little bit, there are all different types of classes, music classes and movement classes, that you can look into joining. And another really helpful strategy is to keep a journal of your thoughts and feelings, things that you may feel ashamed to say out loud. The point is to try to get it out so that it doesn't snowball and cause that extreme anxiety or depression. So to keep a journal of how you're feeling, you know, can really help as well.
Great. Thank you. I think now we're going to all come on camera.
Yes, we are. I'm going to ask everybody to turn on their camera if they can. If not, I'll help you. I'm going to stop the slideshow.
It's not letting me start my video.
Me neither.
Okay.
Yeah, me either.
Okay, it's coming. Smile, you're on camera. Okay, that's everybody.
Great. So there were a lot of questions that people were asking as this was going on. I think a lot of them were also answered as we spoke, but these are some of the ones that came to me. Should women wait to conceive until this is over? And does that change if the woman is already in her mid to late 30s?
Carrie, I think I'll answer that. I think there is no evidence, as I said during my talk, there's no evidence of transplacental spread. So we do not feel, nor do any of the associations, the American College of Obstetrics and Gynecology or any other associations, are recommending a delay of delivery or pregnancy or delivery. I think that, again, you want to be try to be socially conscious. You want to do social distancing. I think COVID is going to be around for a while. I don't think a vaccine is imminent, and certainly if it's available in 12 months or 18 months, by the time it gets to everybody, you may be talking about 2 years. So if you're talking about someone who's older, it certainly doesn't make any sense to delay pregnancy. And I think that we're learning, we're adjusting, and I think you can be safely pregnant and safely deliver during this period. So we are not recommending a delay in pregnancy.
I'm just going to add one thing to that. In March, early March, the American Society of Reproductive Medicine put out a statement halting all infertility treatments. And part of that was to be socially responsible, to keep people social distancing, to not use any kind of conscious sedation or sedation that is used for IVF. So what they did is they said, let's stop treatments to stop people from going out. They did not say we should not be getting pregnant.
Have they changed that yet?
I believe that the recommendations will change as the social distancing in New York ease.
Carrie,
right now, we're not doing elective surgeries in the hospital at all. And when those recommendations change and we have 30% of vents available and 30% of ICU beds available, recommendations for elective procedures will be changed.
Great. Did you want to add something, Hank?
I was just going to pretty much say what Janine just said. I think the concern with some of the reproductive technologies is that there can be some complications. And there was a great desire not to add a burden to any of the hospital systems by having patients who are healthy but having complications from these technologies end up in the hospital. So I think that was a big part. Now that the hospital, the surge seems to be reduced and the hospitals are coming back to a manageable level, I think we're going to start to see an opening of the reproductive endocrinology and the infertility treatments.
Great. Another question was, with all this things getting better and opening, do you have any sense when the hospitals may allow 2 visitors during birth, including the option for a parent and a doula or another support person?
I can answer that. Right now in New York, they had decided that a support person can be in the room and possibly a doula or another person at the same time. Right now at the Northwell, all of Northwell, they have not changed that recommendation because they feel that having another support person in the room is still risky, and they're trying to figure out the guidelines and the best practice. So for right now at our hospitals, that is not allowed. That may change depending upon the number of cases we see, but right now it's still the same.
And it will likely change as social distancing measures change. Because part of that is we can't be 6 feet away from each other in a 6-foot room.
Got it. So this question is, should I take anything to boost my immune system while I'm pregnant, like vitamin C or zinc?
Kerry, I don't think that, we certainly know vitamin C has no deleterious effects in pregnancy. I don't think there's a downside to taking extra vitamin C. I think zinc is also safe. Whether it will be effective or not, I don't think we've seen any studies, but I don't think it can hurt.
This comes up in pediatrics too, and I'm sure you get these questions, Sal. You know, I keep asking about elderberry, like that's the most important thing in the world. But my response is that it just hasn't been studied. And there are some people based on basic science who think it might be good, and there are some people who think it might be bad. So, you know, when in doubt, you're always better off doing nothing.
Right. No, I agree with you. You know, and there's nothing better than a really good, healthy diet. I mean, one of the things that staying at home mandate has created was more time for the parents to really observe what their kids are doing. And hopefully they're getting them to eat appropriately with, you know, really good, appropriate nutrition. I think the concept of zinc came up because part of a cocktail that was done early on was a very large dose of zinc in addition to hydroxychloroquine, et cetera, was part of a cocktail that was used. And then there was also a couple of reports written that folks who might be vitamin D deficient had an increased risk of a more significant illness. You know, everybody in the United States is vitamin D deficient. We all need to take vitamin D or get out in the sun. One of the other problem of the social stay-at-home order is that more people are staying inside rather than going outside. You don't get sick by breathing fresh air. We need to be outside. We need to be in the sun. If we're going to be close to people, we need a mask. We know we need to socially distance, but we need that air. And I'm just so happy we have some good weather now, because maybe we'll get some of that.
Thank you. So this is a question for all of us. There are a lot of questions about people, especially first responders, who are concerned about going home to their pregnant wife, going home to their newborn infant. So, you know, I don't know who you guys have in your house and what their risks are, but we all have people that we love that we're concerned about. So are you sleeping in the garage? What are you guys doing?
So, I mean, for me personally, I am not sleeping in the garage. We work in the hospital right now in shifts. So we're limiting our visit, you know, our time at the hospital in order to prevent people from getting sick. And after a shift at the hospital, I will come home, change immediately, shower immediately, clean all my clothes, wash my hands, and then sort of resume my normal daily activities. If there was a situation where I felt that I had an exposure or was sick, I probably would move into another location in my home to avoid contact with my family until I was sure that I did not have symptoms. But currently we've kind of been continuing at the same practices, washing hands, keeping a distance more probably than we usually do, but for the most part, otherwise at home, it's business as usual.
Anyone else? Dr. Caravella, I know you're working.
Sure. Okay. I think one of the thing I do that I feel is the most important is that at work, I'm meticulous about what I'm doing. I think it's healthy for me, and I think it's healthy for my patients. When I get home, unfortunately, it's a sight to see, but everything comes off. It all goes in the washing machine, jump into the shower, and then ditto, I go back into my regular routine of what I do at home. Lie on the couch, just like everybody else, watch some TV, see what's happening, try to cut out some of the news and watch something reasonable.
Right. You know, one of the saddest questions I got was, you know, is it safe for a mom and a dad to kiss their baby? And you have to do that. You know, you have to kiss your baby. You have to hold them. You know, if you feel that you're sick, just like any other time, you know, let the other spouse take most of the duty and maybe just kiss their feet. And you can kiss their feet and then wash their feet if you need to. But there's no reason that you shouldn't be holding your babies. That's so important for them as well as for you. I would think Carrie agrees with that, yes?
I think what people have to realize is we all live in homes with their own family unit. So we're socially distant from other families. I think it's super important to stay connected and hug and kiss your family. And for me, I have a routine that I have not changed. I put my car in the garage, get completely naked, walk in the door that's near my laundry room, and put everything in a washing machine and run into a shower. And then I'm back to business as usual. I still hug and kiss my 4 children. I would feel disconnected if I didn't. And I think the most important thing is to be connected with our family units. And as Carrie said earlier, Zooming and making sure that we're connected to our families, because if we get sad and depressed, we're more likely to be sick. So if we can take care of our units and hug and kiss our units, we're good. And I would never say to somebody, don't hug and kiss your baby unless they were known COVID positive or a patient under suspicion for COVID until their test came back. And I would say, of course, social distance with a newborn 6 feet away, be with the baby for 10 minutes to feed when you can, and then stay 6 feet away until we get those test results back. But they could still room in the hospital with that baby.
Yeah, I think what everyone is saying is so important. I mean, of course, the physical health and social distancing and, you know, seeing if you're symptomatic or not. I mean, all that is important, but we can't forget everybody's mental health, and that's a huge part of this too. And if we isolate too much, then that's going to have some negative effects too. So of course, while being responsible with the guidelines and what we should and shouldn't do, but absolutely to be able to connect physically with your family unit, and also then, you know, in some way with your other support system, whether it's something like this over a computer or 6 feet away from each other, whatever it may be, it's absolutely a must right now for your other kind of health.
Thank you. So the topic of a vaccine came up. So what do you guys think about a vaccine? Because personally, even if a vaccine comes out, I can't imagine that we're going to give it to children and pregnant women first. Right? I mean, we want to make sure that it's safe and effective. And if children are doing really well with the virus, then the benefit for them has to be really well established to take it.
In order for us to comment, really, we need a well-vetted vaccination, and that's probably going to take 1 to 2 years. So whatever is coming out will probably go to the adult population first. And then as our American College of OBGYN and our American Pediatric Association tells us that the vaccination is safe and when to give it, we'll follow those guidelines. I vaccinate my children, they get the flu shot every year. When it becomes a vaccination that we're giving to everybody every year, I will follow those guidelines.
Absolutely. And I think this shows the public how careful we are with vaccines. A vaccine needs to be fully vetted to be not only effective, but safe as well. And you can't do that overnight. You can't snap your fingers and make a vaccine. But when we have a vaccine, we're going to be sure that it's the right vaccine and it's going to keep people healthy.
Carrie, I think it's also important that we don't necessarily need to initially vaccinate pregnant women and children, because if we can get healthy adults to be vaccinated, there'll be some protection through herd immunity. So if most of the population is vaccinated, it will reduce the risk to those who are not yet ready, or we don't really understand the safety for that population.
You're muted.
Can you hear me now?
Yes, you can.
Thank you. Kevin, I've been going through the questions. Is there anything that I missed that you think would be important to bring out?
Just unmuted myself now. You know, there was a bunch of them about vaccinations and whether they should be getting the flu vaccine or not come fall, and keeping up with that. But I think we covered that good.
Wait, you absolutely have to get the flu vaccine. If you are at all afraid of COVID, flu is much more serious for infants, children, and pregnant women. So you absolutely, if you're thinking about a COVID vaccine, if you're afraid of COVID, you have to get the flu vaccine.
We do not want Flovid. We do not need flu and COVID together. So please vaccinate yourself.
Absolutely. I'm sorry, Kevin. You can't say anything about a vaccine and let a pediatrician let that go.
I love it. No, it's great advice. The other thing is we've got a couple grandparents that are on here, multiple grandparents. And I guess just to Dr. Firestein, you'd probably be great at this. Just to go over the guidelines for grandparents meeting newborns, distancing, holding, et cetera. Grandparents have been quarantining versus not able to because they're working.
Again, there are no strict guidelines for this. This comes down to what the mommy and daddy of that little baby are comfortable with. And if they're not comfortable having you come unless you've been fully quarantining, that is their right. When I talk about risk benefit, right, the benefit really we need to concentrate on the benefit for that small family, for the baby and for the two parents. The benefit to the grandparent has to come secondary. So if the children need you, if the mommy and the daddy and the baby, if they need you, then do what you can to be part of them. And if they have a rule, just like, I have parents that they say that grandma can't come unless she gets the Tdap. And the grandparent thinks it's ridiculous, but that's the mommy and that's the rule. So you kind of have to go with what the parents think. But I am encouraging my new moms and dads that, especially as the weather gets nice, there's really no reason that grandma and grandpa can't see the baby from 6 feet away outdoors. And if we've all been socially distancing, our risk is so incredibly small that if you're feeling well and you wear a mask, it really should be fine to hold the baby. But I cannot tell you that the risk is zero, because you're still probably going out and buying groceries and doing things like that. So it's something that you and the mom and the dad have to come to together. Dr. Caravel, you want to?
Yeah, no, I absolutely agree with that. I think the more attention you pay to your social distancing, good hand hygiene, et cetera, you're really decreasing your risks. And the longer this goes on, the smaller our individual risks will go. And so I have no problem with grandparents as long as we do all of the things that are appropriate. And that's it. The only thing, just the only extra thing is really to remind our parents and grandparents that they have to get that Tdap vaccination. Whooping cough is still very significant as a problem. And, everything is COVID, but there's so many other illnesses, so kids still have to get vaccinated. So for families who feel frightened, they want to hold off, they don't want to go to their doctor visits, these visits are essential. And the offices themselves will make every effort to make sure the environment is safe.
Yeah, right now, most of us are keeping any respiratory illness out of the office. And mostly we're just seeing well.
Exactly. I see them. I see them in my parking lot, actually.
Dr. Firestein, you had actually mentioned in one of the webinars a couple weeks ago that now's probably one of the safest times to go to your pediatrician for a well visit, because we're structured now with what's going on to accommodate, and the dentist that was next door is not open right now. So there's less people in those buildings where you're going. So, it's just so important to keep doing that.
These questions are actually a lot harder to answer in 4 weeks when everybody is not as socially distanced. Then what does grandma do, right? But for now, I think everybody has been apart for so long that the risk is very small.
Right, agreed.
For most of us.
Well, excellent. Does anybody have anything else to add? We're coming up on the 9 o'clock hour. I appreciate, I'm seeing the feedback on the message board, and it's been very positive. So that's always good to see. I thank everybody for joining us tonight as a panel.
I know what I want to add. In about 2 weeks, we're going to have a newborn webinar, Baby Basics. So all the new moms should, because there were a lot of questions that had nothing to do with COVID, that had to do with bathing and belly buttons and car seats. So we're going to answer a lot of those questions when we have our next webinar on newborns in about 2 weeks. So keep your eye out on social media, and I'm sure, Kevin, we can send that link out to everybody as well. Everybody will get it. Yep. Excellent. Perfect. You finished it up for me. That was exactly what I was going to say. Excellent. Sorry. We're becoming a great team here. Okay, so thank you so much, everybody, for joining us. Thank you, parents and soon-to-be parents, for joining.
We hope this was informative. We are going to send a link of this webinar to you. It'll be out sometime tomorrow. We'll also have some accompanying information that might be helpful. And we'll also send you, going forward, any more webinars that we'll be hosting. We've been doing these every week since the pandemic has started, and we will be continuing doing so. So again, thank you, everybody, and have a good night.
Good night.
Thank you.
Well.